Take rests. Increase your physical activity. Be careful about caffeine consumption. Don't drink a ton of it. Eventually it's going to wipe you out. That crash, that sugar crash coming down. Engage in mental exercises. Plenty of things you can do to keep your mind stimulated. You know, one of the things that I implemented in one of the services I worked for was, and you'll respect this in the fire service, was the tailboard talks, right? You can learn more at a 10-minute tailboard talk about something in the fire service than you can sitting in a 2-hour lecture. Incorporate that in EMS. Same thing. Sitting around the coffee table for breakfast, talk about something EMS. Talk about end-tidal CO2, capnography. 10 minutes of discussion. You'll learn more in those 10 minutes from all the people that are so experienced around you, you won't even know it hit you. You'll learn more in that than you will probably in a 2-hour lecture sitting down watching someone speak online like I am right today. Nap early. Avoid heavy pre-sleep meals. Balance your fluid intake. Establish a calming pre-sleep routine. Oh boy. Sleep when you're truly tired. When you're wiped out, you're done. You need to check out, time out. Keep a consistent sleep schedule at night or days. Expose yourself to natural light during your waking hours. Vitamin D is good for you, right? So sunlight is actually very good for you. One of the things I've noticed, especially in Maine, in the New England area, is a lot of people who get wiped out and are tired in the wintertime, go get your vitamin D checked out. I bet it's low. Take vitamin D supplements. You'll start feeling better. People in the snow, the cold, without having all that direct sunlight on your skin, you start getting vitamin D deficiency. And that can cause weakness, tiredness, sleepiness, and times during the summertime when you're wide awake. So you might have a vitamin D deficiency. And your doctor can prescribe, or you can buy them over the counter. Smoking, vaping, chewing nicotine. Yes, Jason, exactly. Get outside. Snowmobile, skiing, things that find your winter activities. Smoking, vaping, or chewing nicotine can lead to cardiovascular respiratory illness as well as cancer. We're already in the fire service as it is, right? So don't try to give yourself any more chance of getting cancer. Protect yourself. Strategies are available to assist with quitting nicotine-containing products. As far as alcohol abuse goes, acceptable alcohol consumption is described to be 1 drink per day for women and 2 for men. Excessive alcohol can adversely affect many body systems and increase the risk of developing certain cancers. So according to the Centers for Disease Control, the CDC, excessive alcohol causes approximately 88,000 deaths per year in the United States, with an economic cost of more than $200 billion a year. Approximately 75% of the total cost of alcohol abuse is attributing to binge drinking. So the side notes that are there. Both prescription medication, illegal or illicit drugs may be abused or misused. And I have not personally seen this happen, but I've heard about it, read stories about it, and there's one that's even more local than people can even imagine, where someone had a significant injury or a small injury to the shoulder, and they started stealing fentanyl and giving patient fluid, water, and saline instead, and pocketing fentanyl instead. All right, and they got charged for 56 counts of narcotic diversion. Simple shoulder injury that regular pain meds just were not working. All right. So rotate your schedule to give yourself some time off. What's nice about rotating schedules, or if you work, 24 on, 48 off, 24 on, the 1 on 2 off, 1 on 4 off, is you only have to work 8 days a month, which means you get 22 days off a month. It's not too bad. And you make some swaps and take maybe a week's vacation. You get like 3 weeks off of work based on swaps and everything else. It works out pretty well. So again, take vacations, go out and do something. Hunting. I found out the hunting season down here is 6 months. I didn't know that. pretty interesting where I'm at right now. Jen, thank you for posting that. Jen just posted the link.
You have to
for the
register
AWR
and then
160.
you have to register, and then I guess it gives you a class time, and then you have to it's free online. You just take it, and then you have to take the test.
That's it.
Thanks, Jen.
Yep.
So infectious diseases are caused by organisms within the body. So communicable disease can spread from person to person or one species to another. Right. So we already know about communicable diseases, right? COVID pneumonia, COVID-19, vaccine, bad. Not vaccine, infection. So the other one is the one we keep forgetting about is tuberculosis, TB. It's still out there. I've actually seen some articles now that I'm seeing it in more. I've seen it in deer. They just posted an article about that not too long ago. That if you cut open a deer and on the ribs they have the white like pussy spores. It's saying that it's a type of tuberculosis now in deer. Interesting. So before you eat it, take a look at it. But yeah, so diseases can spread one person to another. Infection risk can be minimized by immunization. So again, becoming vaccinated. And one of the things, and COVID did this to us, is we started wearing masks. Well, what happened after we started putting masks on? What is one thing that went away almost completely, non-existent?
Colds and flus.
Yeah, the flu. I'm hoping that we didn't just lose our recording for the lecture. Hold on here.
Recording is set to expire. I think you just have to change the date, looks like.
There's a possibility, but I'm hoping that the recording didn't. Oh, it's still recording. All right, well, we're still recording. I want to make sure we didn't lose it. I'm used to using GoToMeeting. This is the first time I've ever used Microsoft Teams for teaching classes. We switched over, so it might do it in 2 different sessions. All right, so protective techniques, gowns, masks, goggles, gloves on every patient contact. At minimum, should have gloves on. It was masks. Believe it or not, even like down here in the South right now, COVID is coming back with a vengeance. People aren't getting as sick as the original COVID-19, but it's still coming back. People are still out of work. We're seeing it more and more and more in the hospitals down here right now. Terminology, obviously, pathogen is a microorganism that is capable of causing a disease in a susceptible host. Contamination is the presence of infectious organisms or foreign bodies on or within objects such as dressings, water, food, needles, wounds, or a patient's body. Exposure is a situation in which a person had a contact with blood or bodily fluids, tissues, or airborne particles in a manner that allows a disease transmission to occur. And PPE obviously is protective equipment. And depends on what level of equipment you're going to be wearing to protect yourself. So routes include obviously direct contact, like bloodborne pathogens, indirect contact, like a needle stick, airborne transmission, like sneezing, foodborne transmission, like contaminated food, like botulism, things like that, or salmonella, vector-borne transmission, like fleas, ticks. All EMTs are trained in handling bloodborne pathogens. The CDC developed standard precautions, whether it be like hand hygiene, washing your hands. Remember that the hand sanitizers clean 99.9%, right? There's still that 0.1% that can still kill you, right? So you need to wash your hands with soap and water to kill everything on it. Protective gloves, gowns, masks, eye protection, face shields. There's going to be certain calls you go on that you're going to want these, and delivery is one of them because it makes one hell of a mess. All right, so you want to be protective. All right, and you haven't had a delivery yet. When you have your first one, you'll see what I'm talking about. Especially if they've already had 5 kids prior. We'll talk more about that in obstetrics. Donning full PPE, removal of full PPE. We're going to go over all that kind of stuff in practical sessions. and perform a consistent sequence to reduce the risk of contamination, right? Because we are dealing with people that are sick. Hand washing is the simplest yet most effective way to control transmission. Wash your hands. There's sinks in every patient room most of the time. And if there isn't, there's one right outside. Wash your hands. Hand sanitizers are not the greatest thing for you. It's a great quick fix, but does not stop you from washing your hands. If there's no running water, then you can use a substitute. But if there's running water available to you, and no, I'm not saying in your patient's house, walk to their sink and wash your hands before you do it. You should already have your gloves on anyways, but still, you're done with the call, wash your hands. Also, please do not wear your gloves in the front of the ambulance while driving to the hospital. Pet peeve of mine. Take them off. Right? That's supposed to be your sacred area. Do not bring more transmission of disease to the front because you want to keep your gloves on while you drive. Take them off, put new gloves on when you get to the hospital. All right. Latex gloves we don't use anymore. Maine is in New Hampshire completely non-latex in the ambulance. You're going to have your nitrile gloves or your vinyl gloves that you'll be utilizing. There's a special technique when removing gloves, which we'll cover on our first practical day. Eye protection protects blood from splatters. Blood splatters, as you can see in the photo here. Anytime you're doing something with airway management, you should be wearing some kind of protective mask and goggles. All right, whether you're putting an OPA, MPA, you're using a BVM, if you're assisting with intubation, because patients can vomit, it can projectile, and it can get all over your face. You don't want that to happen, so protect yourself. As far as gowns go, aerosol generating procedures, field delivery of a baby, major traumas, there is a lot of blood. There's 6 liters of blood in an adult patient, and that can go, and that's total blood volume, and you can lose a lot of it. Even 3 liters of blood is a lot of blood to be losing. Think of a 2-liter bottle of soda, dumping it on the floor. Right? 2 liters of blood. That's a lot of blood. That's significant blood loss. Right? It can make a mess. Ruptured esophageal varices is another one. We'll talk more about that in airway management too. It literally looks like there was a murder scene. How much blood comes out of someone's airway when a varices ruptures. So protect yourself. Standard surgical mask for for fluid splatter, things like that. N95 is the I'm gonna blank the new one, the ones that came out that everybody was wearing for a while. They had the gel seal on them. Envos. People have the Envo masks. Those are really good for the COVID-19 stuff as well. Surgical masks are not going to protect you from COVID-19. All right. It's still going to get through. You need to have an N95, things like that. Other things you can utilize for mouth-to-mouth resuscitation would be a pocket mask with a one-way valve, which is this valve right here where the arrow is currently. Let's see if we can do this. So that right there, that's gonna be your one-way valve. So you can blow air in, but nothing can come back up through into your mouth if you're doing mouth-to-mouth resuscitation. Never recap, break, or bend a needle. The old days of sticking needles into cushions are gone. If it's happening still, that's a bad practice. Right? That's something that someone gets reported for. Keep in mind on critical calls, you might lose catheters, IV catheters, things like that onto the floor. So just be careful. Look around. We're not always 100% perfect. I've dropped them on the floor before underneath the stretcher and I couldn't get to them with a patient there. So I just tell my partner, hey, drop the sharps on the ground. Just keep in mind it's on the ground. All right. There's no employer responsibilities. There's no guarantee of 100% risk-free environment. You got into the field where there's tons of risks that we take and risks that we come in contact with. Right. So the exposure to communicable disease is a hazard of your job. Right. You have the right to wear masks on every call. It's not against the rules. It's just not our policy anymore. If I go to an airborne call, if I go to respiratory distress with airborne illness, I put on my Envo and I go in until proven otherwise that it's not something else. All right, I'm going to protect myself. I'm going to come home to my family and I don't want to bring that home with me. But every department required by OSHA, Department of Labor, whatever state you may be, has to have an infection control plan. And you have to know where it is, what's in it, and who to contact as your exposure control officer within your agency. Infection control should be part of your daily routine. So clean the ambulance after each run and on a daily basis, and cleaning should be done at the hospital whenever possible. Even if germs reach you, you may not become infected. So again, you may be immune. It's okay. Preventative measures, though, receiving immunizations. Like I mentioned before with the flu, nobody got flu shots, and it was pretty much non-existent because we were always wearing masks. We protected ourselves from influenza A and influenza B. So we stayed protected, right? What happened when the mask got when we were told no more masks? They don't have to be worn anymore. What happened? The flu went up. Yeah, we got a big surge of people getting the flu. Everyone's like, "Oh, it's COVID." Nope, it's the flu because we didn't have any protection against it, right? We didn't have protection. That's what happens. And flu shots are great, but only protects the current strands that are out there, not the ones that are brand new. So it does help. And we're not gonna discuss COVID vaccines. Everybody has their own opinion about those. I personally am fully vaccinated with a booster. I never got the second booster though. I did the first two and then the booster shot. The CDC recommends immunizations for Hep B, influenza, measles, mumps, rubella, or MMR, varicella, which is chickenpox, or have had chickenpox in the past, or your Tdap, tetanus, diphtheria, pertussis. All right. The MMR is done once usually when you're a baby, it gets done. Influenza is done on a yearly basis. Hepatitis is 3-shot series. After that, they can draw a titer to make sure it still sits. They can also do a titer for MMR. Your tetanus is 10 every 10 years, or unless you have some kind of exposure, then they give you another tetanus shot. And a skin test for tuberculosis. If your skin test pops positive, you have to go in for a chest x-ray to prove you don't have TB. Or maybe you do. If you've ever had TB in the past, you're always going to have a positive TB test, Tdap, but positive TB test. If you're exposed to a patient's blood or bodily fluids, clean yourself. So turn over the patient care to another EMS provider, clean the exposed area, rinse your eyes for 20 minutes if necessary, and then activate your exposure control plan or your infection control. Even if you have no harm done to you, still fill it out. Document it. Because the town or the city has 24 hours during the weekday and 48 hours in the weekend to report that to the state. If not, they get fined. So you gotta make sure you turn that in. Begin protecting yourself as soon as you are dispatched. Okay, listen to the dispatcher of the call when you approach. Make sure you have the appropriate PV when you're approaching calls. As far as hazmat goes, yes, I understand this is a wheel stop for those hazmat techs in the room, right? You're good for the first 20 minutes of an incident. After that, they're pretty much useless. But there's still ways to identify what's going on, and placarding is huge. That's why every ambulance has a binoculars in them required by state rules. Electricity beyond the scope of EMT training. All right. So mark it off as a danger zone. We do not go anything energized. That is what power companies are for. Lightning, a repeat strike can occur, and either a direct hit or ground current is possible. There was a physician who used to work in Stamford, Maine, and his son was struck by lightning and killed on a hiking trip. Very sad. Fire, well, that's a hazard. For those of you that know fire, it's a hazard. We can't go in unless we have the appropriate PPE. I don't know who still uses those bottles now. All right. So use proper protection. Fire hazards include smoke, oxygen deficiency, high temperatures, toxic gases, building collapse. Even technical rescue is dangerous as well. Vehicle crashes, same thing. Right? We do not enter the vehicle until the vehicle is stabilized. I don't care if there's somebody dying in the vehicle or not. Don't put yourself in harm's way. Right? Simple stabilization can work to get people inside depending on the situation. But again, that's another whole certification class you have to do. As far as scenes of violence go, assaults, riots, hostage situations, you just got to make sure you keep yourself safe. All right. That's the biggest thing with those. As far as mass violence goes, know who's in command. Remain vigilant for the potential for more violence. Allow law enforcement to clear the scene. And at scenes involving projectiles, find protection. Right? Most recently, there was an incident over in Naples, right? You guys heard about that one with the shooting? Okay. During a mass event, a big event. Whether it be intentional for mass casualty or one person being shot for a purpose, or I should say for intent, it still causes mass chaos, right? So again, be aware. Be aware of your surrounding, what's going on. We had one down in Revere not too long ago, and one of our Winthrop trucks for Action Ambulance went over there, and they had multiple people. They had 4 or 5 people shot from a drive-by shooting in a mass gathering. So again, allow law enforcement to clear the scene. We are not part of a tactical team, right? Unless you're part of one. But if you're not part of a specific tactical team, we don't go in. We don't go into hot zones. We stay out in the cold zone and say, bring patient to me. So there's a hazmat situation. EMS does not work in the warm zone. That's where decon is being taken place. They bring us clean patients. So EMS functions in the cold zone. All right. We stay outside. Let's see. Where are we at here? So recommendations for preventing violence, obviously training and practice identifying scenes. Look around, be aware of your surroundings. I had a paramedic instructor one time in my class that I was taking many years ago, and he would come in before class and he would tape like fake knives and stuff underneath the seats to see if anybody would pick up on it. It didn't take long before he started saying, "You're dead, you're dead." And to turn your chair over and there was a knife there. So every time we went into class, we were like lifting up tables and chairs looking for stuff because it made us aware of our surroundings. People take things for granted. Oh, I live in a small town. It doesn't mean anything.
A Bangor medic just got stabbed a month ago, 2 months ago.
Yeah, you're right. Yep. Just because you think you know the res, I've seen this so many times. This is my soapbox stuff again. I've seen this so many times where in volunteer services they go to a house for violent acts. Oh, I know those people. I've been there many times. We're friends. When you're not in the right headspace, guess who doesn't know who you are? I don't care if you've been best friends for 20 years. If they're intoxicated or they're not in the right headspace or they're bipolar or they're schizophrenic and they're having a manic episode, whatever it may be, it doesn't matter. Right? They don't know who you are and they can actually hurt you. And I've seen this happen more and more times than I can even count. People said, "Oh, I got this. I know who they are. We'll go in without PD." Next thing you know, you're getting shot. So something to think about. Recommendations for protection against violence, training, self-defense, escape techniques. Nothing that I'm going to teach you guys in class. I'm not going to go there and start wrestling with you guys in a classroom. But you should at least learn some different techniques. If you take my water rescue class, we did defensive maneuvers in the water. That was part of the program, the curriculum. Fitting and use of body armor. So there's some services that I've worked for in the past or still do per diem stuff for, that if you go to any call involving any kind of act of violence, you're wearing a vest and a helmet until proven otherwise. That's department policy. So again, there's different things that are out there. As far as protective clothing goes, preventing injury, critical to personal safety. So become familiar with the various types that are out there, like cold weather clothing, things like turnout gear. What you should be wearing, common sense. What should you be wearing on these types of calls? All right. We went as far as making go bags where I used to work full time, and the go bag had ice cleats in it, things like that, flashlights for the crew. So they had to call in the wintertime, they had to walk out on the ice. We got cleats for the crew for their boots. Simple little things that don't cost a lot of money that can actually save someone's life or prevent injury. One injury, again, protective clothing, preventing injury. An injury to a provider then puts out workers' comp, rehab, hospital bills, the loss of you being on that shift, covering that shift with people that fill overtime. The cost is astronomical when someone goes out on injury. And if they're out for a year, that's a year of being under disability and being out for work. So they only give you, I want to say it's like 60 or 70% of your last 3 paychecks is what you're going to make on workers' comp, if I remember correctly. Right. And some people that live paycheck to paycheck can't afford a 30% deduction for 1 year. So think about that kind of stuff. Protect yourself. Gloves, helmets, anti-slip boots, things like that. Just there's things to look out for as well. Eye protection, ear protection, like foam earplugs, skin protection, sunblock, body armor, vests. Again, know what your service carries and what they carry on the truck. Eye protection is required on every ambulance. You have to have safety glasses on every ambulance. I'll let the patient know who you are and what you're doing. Don't just start grabbing patients, right? That's called assault and battery, right? You can't just touch a patient without gaining permission, unless they are unresponsive or altered. Then that would be considered implied consent. And under medical legal, we will cover that more in detail. Well, they should know you are attending to his or her immediate needs. I am here with EMS. I'm here to help you. Let them know what's going on and talk them through it. Especially to get the pediatrics, you're going to want to know that, right? We do something called a toe-to-head assessment in peds, because pediatrics require that because they need to gain your trust, right? I'm 6'4". I walk up to a 3-year-old. What do you think that 3-year-old is going to do? Right? They're going to be scared. Get down to their level and start touching their feet first and do your toe-to-head assessment on a pediatric. And then we'll cover more of that later. Communicating with the critical patient, obviously avoid sad, grim comments. Don't go around telling them you need to cancel Christmas this year because grandma's going to die. Right? That's something you really want to be saying. Things like that. Don't cancel Christmas or no longer playing records for, there's all these different ones that are out there. Again, avoid your sad, grim comments. Just kind of put out there as a statement. We just had a paramedic legit lose her EMS license in the state she's practicing, and they suspended it for 2 years because she made comments about a cardiac arrest patient on a scene. And the state suspended their license for 2 years because comments were made. So avoid that. It's out there. Orient the patient. Deal with the possibility of initial refusal of care as well. Allow for hope. Locate and notify family members, things like that for critically ill patients. You wanted to make sure you decide also on how much information your patient can understand and accept. Don't go into medical mumbo jumbo jargon. They don't understand it. They're not us. They didn't go to school to learn this medical terminology, right? Tell them and explain to them the things that they would understand, like the layperson would understand. Right. Injured or critically ill children, ask for a responsible adult to accompany the child. Have them come out back. A death of a child is a tragic event. All right. So coping with the death of a child can be very, very hard to deal with, whether it be your own, being a family member, or you being the provider and having kids at home. Acknowledge the death in a private place as well. So again, helping the family out. Shock, denial, and disbelief are common emotions and reactions for a child's death. The children are not supposed to die. Right? It's not in the plans. Right? They have a full life ahead of them. If circumstances allow, let the parents hold the child and use your best judgment to determine if it is appropriate. Now, if you think it's a child abuse case, no, they're not going to be getting anywhere near the kid at all. But if it's not, as let's say a SIDS death, crib death, okay, let them hold the child. It's, it helps with that separation towards the end. Death occurs either quite suddenly or after prolonged terminal illness. With the EMT, you will face death at some point in time. There are 5 stages of death and dying: denial, anger, hostility, bargaining, depression, and acceptance. And these things truly do exist. So the EMT role is ask how you can help. What can I do to help you? I am here for you. Reinforce reality. Okay? They're not coming back. I'm not saying tell them that directly, but again, reinforce that reality that they are dead. Be honest about it, right? And allow the patient and the family to grieve. So words of comfort when responding to grief. I'm sorry for your loss. It's okay to be angry. It must be hard to accept. That must be painful for you. Tell me how you are feeling. If you want to cry, it's okay. People really cared for whoever it may be. Right? Wording is huge when you deal with patients like this, or say family members. EMS is also a high stress job, so it's important to know the cause and how to deal with stress. General adaptation syndrome, alarm to response to stress, reaction to resistance, recovery or exhaustion. Right. And we see this general adaptation syndrome on these patients. You truly do see this. So physiologic signs of stress would be increased respirations and heart rate, right? Increased blood pressure, dilated venous vessels near the skin surface causing cool, clammy skin, dilated pupils, tense muscles, increased blood glucose levels, perspiration, and decreased blood flow to the GI tract. Where you're going to learn about this is your sympathetic nervous system kicking in, right? So your body is releasing neurotransmitters called norepinephrine, causing this to happen. When we start getting into human body and pathophysiology, I'll cover more of this stuff in detail with you, right? But this is a sympathetic nervous response. So situations that are stressful for EMS providers include the following: a dangerous situation, physical or psychological demand, critically ill or injured patients, death and dying patients, overpowering sights, smells, and sounds. You are going to smell some of the worst things you ever smell in EMS. My recommendation to all of you is carry a bottle of Vicks Vapor Rub with you on calls. Put it underneath your nose and it gets rid of a lot of the smell. One of the worst smells that I have, I don't like doing poop. That's not for me. I'd rather smell vomit than poop. And C. diff is disgusting. All right. So I would highly, Jen's like, yes, it is. She knows. Right. All right. So these are certain things you want, if you come in contact with, have an availability to be able to do that. Multiple patient situations, also angry, upset patients, family or bystanders, and unpredictability and demands of EMS as well. Great. We're almost done. So acute stress reactions obviously occur during a stressful situation. So delayed stress reactions manifest after stressful events, and the cumulative stress reactions are prolonged or excessive stress. So again, you have to understand where you're going, what's going on, and again, talk to people. Have that conversation. Some physical symptoms of stress would be fatigue, changes in appetite, GI problems, headaches, insomnia or hypersomnia, irritability, inability to concentrate, hyperactivity, or underactivity. Some psychological symptoms would be fear, dull or non-responsive behavior, depression, guilt, or oversensitivity, anger, irritability, and frustration. Critical incident stress is caused by an acute severe stressors. So like an MCI, serious injury or traumatic death of a child, crashes with injuries caused by emergency provider while traveling to or from a call, death of or a serious injury of a coworker in the line of duty, right? Something that I'm not sure if anybody's ever experienced. I've had it happen before in one of my departments, 3 days after I took over as a chief. One of our responders responding to a call wasn't wearing a seatbelt. He got ejected from his vehicle. He died on impact. The long-term effects of that were astronomical with the amount of money that was paid out. The National Foundation of Fallen Firefighters getting involved, the investigations that had to happen behind it, and the family not having any money to help with the funeral costs because it took over a year for them to get any benefits because of the investigations. They went through files with a fine-tooth comb. So again, something to keep in mind as well. And our department pretty much shut down for an entire week. We had mutual aid entities covering because we just no one wanted to go on calls. They just needed to grieve. Many developed following psychological distressing events characterized by re-experiencing the event and over-responding to stimuli that recall that event itself. And everybody's going to have those types of events in their life. They're going to come up with something that's going to be very critical with that. And there are certain things that are called triggers that might trigger a response for significant stress because you might relive another call that you were on. So critical incident stress management used to help providers relieve stress. They are not mandatory, but they're provided to you. So someone activates the CISD or team to come in, they set it up. You don't bring your pager, your cell phone. They don't provide you with junk food. They provide you with healthy snacks, things like that. And you sit there and you have your, it's open for you to discuss. It is not a critique of the call. It's not that you did this wrong, you did that wrong, right? It's not an after incident review. It's a critical incident stress debriefing, right? To talk about what happened, get your thoughts off your chest. And there are trained professionals that run it. A combination of exhaustion, reduced performance, long-term job stressors, all this stuff here can cause burnout, right? The average burnout for EMS providers is 10 years, right? Not a lot make it past 10-year mark. I've been doing this now for almost 25, right? You got to find a way to relieve your stress. You have to be able to go out and find something that helps with that. Compassion and fatigue, also known as secondary stress disorder, is characterized by a gradual lessening of compassion. Symptoms would be high absenteeism. So you have someone that was very active, showing up all the time to the station, helping out, volunteering his time. And next thing you know, they had a bad call and he's gone, disappears. Right? Inability to work in teams, lack of empathy for patients, judgmental attitude towards patients. The things to think about as well. Responder risk for suicide. Suicide rate among emergency responders is higher than the rest of the population, caused by job stress. So several organizations of mental health services are available to provide emotional support. Almost there. So at times, the healthcare provider had trouble overcoming personal reactions and proceeding without hesitation. So again, the struggle to remain calm in the face of horrible circumstances contributes to that emotional stress of the job. So many factors influence how the patient reacts to the stress. Professional tone and show courtesy. Allow the patient to express their fears. Respect religious customs and needs. And that's something that everybody needs to be very familiar with, is different religious customs and needs and what people can and can't do, where they can and can't say, where they can and can't go, where they can and cannot receive. Right? So again, you have to respect their religious beliefs. You cannot go against that. Cultural diversity on the job. You're expected to work with coworkers of varying backgrounds, beliefs, and values. Right? So keep that in mind. Culture includes nationality, age, disability, sex, sexual orientation, marital status, work experience, and education. So be that senior leader. Sexual harassment, 2 types: quid pro quo, request for sexual favors, in a hostile work environment by jokes, touching. I get firehouse talk. I've been there, lived it. I understand it. But we got to remember that we got to make sure we keep things professional. Okay. So harassment can be, this is not a harassment class, but again, report harassment to your supervisor immediately and keep notes. All right. Just be professional. talk to your coworkers like you would talk to your family members. Hopefully it's all professional for the most part. So substance abuse obviously increased risk on the job, leading to poor decision making. So employee or EAPs are often available, and this is not an action plan. This is an employee assistance program. So if your coworker is using things like that, there's other ways to kind of help with it. Get them the help that they do need. And last one, then we go to review questions, and we're going to call it a night. So workplace issues, obviously injury and illness prevention. Programs should contain management leadership, worker participation, hazard identification and assessment, hazard prevention and control, education and training, or program evaluation and improvement. CQI and QAQI is not just looking at run reports, we're looking at quality assurance on an operational level and providing quality improvement, coming up with improvement plans. All right, so 10 questions and we're going to call it a night here. So a disease that can be spread from person to person is known as what? Person to person. Think of tuberculosis. So the correct answer is B, communicable disease. It's spread from person to person or a person with species to another. So like TB being one of them. Oh, you're a good answer. But the most effective way to prevent the spread of disease is what? I kind of gave you guys the answer already. I apologize. All right, hand washing it is. While caring for a trauma patient, the EMT has blood splash into her eyes. This is an example of what? All right. Right, B is the answer, exposure. Protective measures that prevent healthcare workers from coming into contact with germs are referred to as. All right, the answer is B. What is the second stage of response in the stress response known as general adaptation syndrome?
Oy. No, I don't think that's right.
All right, correct answer is D. So reaction and resistance. Oh, number 6 is D. Went a little too far on that one, but a condition characterized by re-experiencing an event and over responding to stimuli is called PTSD. Blank is the fuel to make the body run. What makes the body run?
All of the above.
Now, think about fuel. Fuel, right? You guys are all putting sleep.
Let's see.
Yeah,
Food.
C, food. Nutrients. Which stage of grieving commonly results in blame? What stage of grieving commonly results in blame? B, anger and hostility. placards are used on, this is more for hazmat, or I shouldn't say hazmat, not just hazmat, for I probably didn't cover much of this in detail. Buildings can also be placarded as well for do not enter, no entry as well. So the answer is actually A for buildings, and I did not cover this with you guys. But the placards can be used for over the road hazards, things like that. They can also be used in, there's different types of placarding systems that are out there, but this one here is, in this case, is buildings and transportation vehicles. The 5 most common hazards associated with structural fires include what?
Smoke, oxygen deficiency, high toxic gases. Smoke, pollution, toxic.
Cody, all of them. Yep. Everything's bad. But the correct answer is A. All right. So this is probably one of the longest lectures we're probably going to have, running the full 4 hours. Class Tuesday night at 6. Feel free to shoot me a text or email me if you have any questions till then. The quiz for chapters 1 and 2 open at midnight tonight, and we'll close at midnight next Friday. All right. So we have class Tuesday, 6 p.m. Please make sure you get those waivers of liability and student manual acknowledgements done. For those of you who have not paid yet, I know that some of you are waiting for bills to go to the departments. Those should be going out this week. All right. Is there any questions for me at all?
Kevin, can you just make sure that you can see me now on the JB Learning?
Yes. So I'm going to let everybody else go, and I'll stay on the line with you, and I'll look it up.
Okay, perfect.
Morgan, you got anything for anybody if you're still on?
I do not know.
Okay.
Thank you.
All right. Other than that, thank you guys for everything, and I will see you guys next Tuesday.
Thank you, Kevin. Have a great night, guys.
Thanks,
too.
everyone.
You
See ya.
too.
All right, Jen, I'm gonna stop the recording really quick.
Yeah, no worries. I just want to make sure. I think I've worked it. If not, I'll call them tomorrow.